Welcome to the Explainer. Today, we're diving into a piece of technology that could completely change medicine, the digital twin. It promises a future where healthcare is perfectly tailored to you. But as we're about to see, the biggest hurdle isn't the science, it's all about trust.
Just think about that for a second. What if we could do away with all the trial and error with medications? No more one-size-fits-all treatments. Instead, there's a perfect simulation of your body, predicting exactly how you'll react, maybe even stopping a disease before it ever shows up. And look, this isn't science fiction anymore. This is the future that digital twins are aiming to build right now.
So, to really get our heads around this future, we first need to ask, what in the world is a digital replica? Okay, so that term in silico, it basically just means a really smart computer simulation. Think of it like your virtual self. It's a model built from all your personal health data, your genes, your lifestyle, the data from your watch, your medical records, the whole shebang. And this model, it's not static, it's always updating. So you can run simulations on it, forecasting your health, and testing out which treatments will work best just for you.
And I want to be super clear here. This is moving out of the lab and into reality fast. Researchers are already making virtual cells, they're simulating how the human heart functions, modeling all these complex organ systems. The building blocks are here, and the computing power we need to run these things is getting stronger every single day.
So, the technology is coming. No doubt about that. But are we, the public, ready for it? Some fascinating new research gives us a look at what people really think, and the answer is kind of a complicated yes but. A major survey in Switzerland found that a pretty clear majority, 62% of people, said they would actually welcome a personal digital twin. That's a really strong signal that people are interested in this kind of transformative tech.
And when you dig into why people are so interested, the reasons are incredibly practical and medical. People see a huge benefit in using a digital twin to better coordinate their treatments, to predict how a disease might progress, and to catch health risks super early. So this isn't about some cool new gadget, it's about getting better healthcare.
But, and this is a big but, there's a catch. One person in a focus group said something really interesting. They said people might be strived of their trial and error approach. What they're getting at is the public's single biggest fear, autonomy. There's this deep-seated worry that if our lives are perfectly mapped out by a computer, we might lose something that makes us human. The freedom to make our own choices, and even our own mistakes.
This concern, this fear about losing our autonomy, it leads us straight to the biggest challenge for any company trying to get into this space. You could call it a billion-dollar problem that boils down to one simple word: trust.
And the data here just spells it out. It's a huge problem. When you ask people who they would trust to handle their digital twin, they overwhelmingly pick universities and public hospitals. But trust in big tech and pharma companies? It's shockingly low. We're talking less than 10%.
And this creates a massive paradox for the whole industry. The groups that people trust the most, the universities and public hospitals, they just don't have the cash or the commercial drive to build this thing at scale. Meanwhile, the private companies that are most likely to actually develop it, they're the ones people trust the least.
This trust gap is tied directly to our data. A whopping 69% of people are worried that using a digital twin will mean they're forced to share their private health data, or they'll risk getting shut out of the healthcare system.
But here's the fascinating part. Even with all these fears, people aren't rejecting the idea outright. Instead, they have a very clear vision for how it should work. They want it to be a tool, not some kind of tyrant.
Think of these as the public's non-negotiable terms and conditions. First off, a massive 87% insist it can't be mandatory. 79% say it absolutely has to be a tool for doctors to use, not a replacement for them. And this is critical. People demand the right to not know a prediction, the right to always see a human doctor, and that the state, not a private company, should be in charge of the whole infrastructure.
So you can see these two futures sort of battling it out. On one side, you've got the public's vision, an amazing tool that helps doctors give us better care. And on the other side, there's this deep fear of a corporate system that's just designed to force us to share our most personal data. Any successful strategy has to walk that tightrope perfectly.
So how can companies actually bridge this enormous gap? Well, the research doesn't just point out the problem, it also points toward a really clear, actionable path forward for any leader looking at this space.
It really breaks down into a three-step strategy. First, partner up. Private companies have to work with the universities and hospitals that people already trust. It's a no-brainer. Second, empower, don't replace. You have to design and talk about these things as tools that help doctors, that make them better at their jobs. And third, and this one is so important, guarantee choice. Make it crystal clear from day one that opting out is always okay, and there will be no penalties for it.
When you boil it all down, for digital twins, the tech is really only half the battle. The ultimate takeaway is this: trust is the new currency. The market for personalized medicine isn't going to be won by the company with the fanciest algorithm. It's going to be won by the company that actually earns the public's trust.
And that leaves us with one final and kind of thorny thought to chew on. In a world where these tools are everywhere, what happens when a digital twin's perfect, data-driven prediction says one thing, but the gut feeling of an experienced doctor says another? Who should we listen to? That's the kind of question we're all going to have to answer, and probably a lot sooner than we think.